Welcome to the program. I'd like to tell the audience about a very worthwhile cause, an organization that's been in existence for several years by some people who are dedicated, serious, and motivated to help others in the world, particularly in Africa. It's the organization named American International Foundation for Africa's Healthcare. It's a serious organization, and they mean to do well, and they have done well. I'd like to introduce Delphine Pregnon. She's one of the founders and principals of the organization. She's sitting to my left. Her husband, Marcel Koassi, also one of the founders and principals in the organization. And their guest, Linda Maranville, who had the opportunity to visit Africa herself personally in Zimbabwe, and we're going to get her story later on in the program. Delphine, welcome.
Hi, Dean.
Hi. Tell us a little bit about the organization. I know it's non-profit, it's tax exempt, it's an organization that's set forth for these causes. Tell us a little about the mission statement and the background and so on.
AMIFAH is the American International Foundation for Africa's Healthcare. Our objective is to help with the healthcare system in Africa.
Okay.
Also contribute to the education system and help improve and reduce poverty.
That's basically what you're doing. I know there are other particulars.
Sure.
Marcel, you want to amplify on that?
Of course, there's several ways to achieve those objectives. First of all, we also want to try to help found some health clinic over there in Africa.
Yes.
Everybody knows that the situation is really disastrous over there in terms of healthcare over there. Mm-hmm. So because right now they're facing the catastrophe like malaria, HIV/AIDS. So one of the objectives is to really select some projects over in Africa and get the money to fund them to be able to really face those, those diseases.
Yes, and it's something that is of prominence. I know most of the viewing audience knows about some of the healthcare issues in Africa, and this organization has been designed and set up to assist many of these people in need.
That's correct.
And actually, as Marcel, well, actually, Delphine, your background is as a pharmacist, isn't it?
Yes, I am.
So you are familiar with the drugs that may be needed to help these people. Can you tell us a little bit about that?
Yes, I am. First of all, I had my degree in pharmacy in Africa.
Okay.
Where I work in the healthcare system over there in hospitals, in rural areas. So this made me acquainted with the situation over there, like how to improve the water system, how to work on the malaria, mosquito nest, how to eradicate the malaria over there. And then I moved to the U.S. in '91, where I have been working as a pharmacist since '93. So as you said, this gives me a good knowledge about the medication and the need over there. And what we really bring as a AMIFAH and with my background is that we have a team in the Ivory Coast of pharmacists, pharmacy students, because one of our goals is not just to gather goods here and send it to Africa, but actually have a team in place over there in a healthcare system that is going to help, that we're going to fulfill our project over there.
Okay. And part of that project is supplying them with medicines, with some kind of healthcare infrastructure so that they can use there. Is there an emphasis on one African country over another? I mean, I know Ivory Coast was a favorite for the benefits. Does that still hold true, or in general, Marcel?
The reason why, actually, the focus is in all Africa.
Yes.
Of course, we just started about a couple of years ago. We don't have the means to really cover the whole Africa
good
right
point,
now.
Yeah.
So we're going to start like in Ivory Coast, which is in the west part of Africa. And we're going to start to put together the project over there. we're gonna get the experience, and also we're gonna be well known, and then we're gonna be able to really expand our mission throughout the country.
That's a very good marketing plan, and it's very sensible too. Start somewhere, because Africa, as we know, is a huge continent.
Yeah, sure, everybody knows that. Yeah.
Let's talk a little bit with Linda Maranville. She had a very unique experience in Zimbabwe, and I'd like to hear from her some of her views and some of your observations there. Can you tell us about that, Linda?
Sure. I first heard about this hospital, a missionary hospital in Zimbabwe, because I'm a nurse, and I read through a nursing article about this lady who works there and has worked there for 30-some years. And she had her email address and asked if anyone wanted to ever volunteer to let her know. So I did. I emailed her, and it took me about a year to get everything together, and went over there. And it's way out in the bush. So there's a hospital there. It has about 80 beds. They don't have a doctor half of the time because the doctors work in town. They would rather not go to the bush. So she's a nurse practitioner, but she does mainly all of the doctor's work. But they have most of their patients, 85% of them are AIDS and TB, tuberculosis. The women, the same, they have it as well, but they're passing it on to their children through either childbirth or by breastfeeding. So I told her when I came back here I would try to get baby formula for them so that at least they could stop maybe transmission during after the birth process. But I saw a lot of people bitten by crocodiles and bitten by poisonous snakes, and their gloves, they reuse all their gloves. They just wash them and dry them and reuse them.
So there's a big need here.
A huge need.
For infrastructure, for supplies, for medicines, for pharmaceuticals, right, Delphine?
Yes.
So even in Zimbabwe, where we have Linda's personal experience, there's a large need. Now, how, when you were viewing these things, I mean, how did you feel? Were you able to, you know, I guess you really sympathized with these people, and you saw the large need here for help.
Mostly, yeah. It was the standard of care. Comparing it to the United States, it doesn't even compare. But a lot of it had to do with the education of the people and their understanding of what was going on and happening to them. And then a lot of the staff there are not committed to staying there and working. So they would leave, you know, in the middle of the night and not come back. And they're very short-handed there. We buried several children there from AIDS contracted from their parents, from the mother.
So actually, Marcel, going back to your point, it really some kind of infrastructure would help these people.
Oh, yeah,
a little hospital, a little care center, something.
Yeah, definitely.
And AMIFAH is planning to organize and raise money for that purpose.
Yes. That's the reason why the pharmaceutical backgrounds is really going to allow us to get in touch with those pharmaceutical companies, you know, and trying to get some medication to go over there and identify some projects over there in Africa. Or maybe a lady say open a clinic to help maybe some orphans, HIV orphans. So we can just go over there and maybe try to put the money over there, some medication.
You know, we have an interesting example. Linda's experience with, you know, like you said, pharmaceutical companies who want to donate to AMIFAH and say, here's a donation of malaria-related or AIDS or TB-related medications. You have a specific place where they could directly benefit from, and the world would be a better place for these type of things, you know.